Hello, I'm Dr. Marshall, and I would like to talk to you today about a weight loss program that we have here at Medical Specialty Clinic. So this is a weight loss kit. We order these from Olympia Pharmaceuticals. You can go to their website. I believe it's olympiapharmacy.com. And I have a lot of patients ask about ways they can lose weight other than the typical, diet pills, things like that. And this is a really neat product. It combines 3 different treatments. There's no controlled substances, no habit-forming medications, anything like that, and it actually works pretty well. It's a 3-month program typically, is the way it's prescribed, and each kit lasts for about 30 days. And so I'm going to open one up here, and I'll show you what's in it. So the kit has 3 different things. It has what we call low-dose Naltrexone. So it's much lower than a typical dose of Naltrexone. And Naltrexone, oddly enough, is used to treat opioid intoxication. So it can reverse opioids. It's also used to help with alcoholism. So it can decrease cravings for alcohol use disorder, and also can increase inflammation. Some people use it and take it to help with inflammation, joint pains, things like that. So there's some evidence that low-dose Naltrexone can help in lots of ways. There's a low-dose Naltrexone is one product, and the other 2 are Sermorelin, which is an injection that helps increase growth hormone levels. It's just a subcutaneous injection, just underneath the skin, very small needle, small amount. And then the third is Lipotrim sublingual spray. So that combines B vitamins and some amino acids. I'll go through the components here in just a minute, but those are the 3 items in the kit. So Naltrexone, Sermorelin, and Lipotrim. So here we open the kit, and you can see, so the first item here is a bottle of Naltrexone tablets. So there's 30 tablets in there. They are 1.5 milligram tablets. So the only difference between the first month, second month, and third month is the dose of the Naltrexone. So it starts out at 1.5 milligrams a day, and then the second month is 3, and then the third month it goes up to 4.5 milligrams. So this is the first component, and typically you take this at night, probably with supper, with your evening meal. Also, some people take it in the morning and say it helps with their food cravings all through the day. So either way is fine. It does not have to be taken at any certain time of day. So then the second component is actually the injection. So it comes with two vials. You just squeeze that and open it up. And so this is the diluent to dilute the actual medication. So the actual medication comes in a pellet form inside the vial. So you will draw up the fluid out of this vial and inject it into this vial, and then that is your supply for the Sermorelin. And then the kit comes with syringes. They're insulin syringes. It also comes with a syringe to draw up the fluid from one vial and add to the other. And then it comes with 30 insulin syringes. You can see, I'll open one up here. They're very small, easy touch insulin syringes. There's several different brands, but that's the one with this kit. So very small needle, 30 gauge needle. So it goes under the skin. You can feel it, but it's certainly not anything that someone can't handle pain-wise. So that is great. Increasing your growth hormone helps with metabolism, helps with calorie burn. It also helps you sleep at night. So you take that injection at night just before bed, and most of my patients tell me it makes them sleep very soundly. They get a much better night's sleep, more restful sleep, and really that is one of the big benefits of the growth hormone, and it helps with weight loss. So then the third product is the Lipotrim sublingual spray. So this is very simple. It's just a spray, and it does not taste good. I have to be honest with you about that, but it only lasts for a few seconds. So you spray 3 sprays under your tongue. You let that sit for 20 seconds. Then you swallow, and then you spray 3 more sprays and let that sit for 20 seconds. Then you can swallow it, and you can go on about your day. So that's very simple. And so this is, I love how they have all the ingredients, if you can see that, listed on the bottle. Some people try to hide with, they'll say proprietary blend, and they don't put what's actually in there. So just real quick, this one has thiamine, folate, vitamin B12, choline, acetyl L-carnitine, inositol, L-arginine, L-leucine, betaine, and L-methionine, but it is listed out actually what's in there. So I really like that about a product. It's a good sign for a medication when they list every ingredient that's in it. So that is the weight loss kit from Olympia Pharmacy. This is a month 1 kit, and it comes with instructions on how to take it and how to store it as well. So all the instructions, that's 1 month kit. You repeat that basically for 2 additional months and hopefully get some of that weight off. Enjoyed talking with you. And as usual, before you start any diet plan, please discuss that with your personal healthcare provider, as all this is just for informational purposes. This is not direct medical advice for an individual. This is just general information. Please contact our office if you have more questions, or if you would like to get started with a diet plan. We have certain other options as well, and we will try to use every tool we can to get people to a healthy diet and a healthy weight. Thanks again, and I'll see you in the next video.